All right, this is Meagan Hubbard. I have my speech for endometriosis, and here's my audience. And now I'm going to pass the camera off. I've suffered with endometriosis for most of my life. From childhood to adulthood, this disease has plagued me and forced me to endure a complete hysterectomy at the age of 26. In fact, many of the women in my family have suffered from endometriosis. Hundreds of thousands of women suffer from endometriosis every day. This is a wonderful opportunity to inform you of the facts of endometriosis and spread awareness. Someone in your family may very well be suffering from endometriosis. It is my hope and prayer that maybe after hearing what I have to say, that you will understand a little bit more. I believe there are 4 main points that everyone should know. The risk signs and symptoms, what you can do to cope with the disease, what you can do to help others living with this disease. I will now take you through the basic signs and symptoms of endometriosis. First and foremost, every person should be informed of the signs and symptoms that are associated with endometriosis. Endometriosis consists of more than 200,000 cases reported per year, according to the Mayo Clinic. Your bodily functions are the #1 indicator that you may be suffering with endometriosis. According to the Mayo Clinic, women that suffer with higher than average menstrual pain could be suffering from endometriosis. Also, the risk of ovarian cancer is higher among those that have endometriosis. I personally believe that there are genetic factors with endometriosis. Both my maternal and paternal grandmothers suffered with this disease, along with my maternal and paternal aunts and my mother. We were all forced to have hysterectomies at very young ages due to this disease. The symptoms alone are proof that you or your loved one may be suffering with endometriosis. Retrograde menstruation is the key to understanding how the disease forms. This can best be described as when blood flows back into the pelvic cavity, therefore causing the endometrial cells to flow back inside. This then forms a type of glue that causes the pelvic organs to stick together. Suffering from severe pain during the course of your menstrual cycle is a common sign of endometriosis. Also, according to the Mayo Clinic, pain during intercourse is not uncommon. Although those were just a few facts, there are many more complex details to this disease. However, now I believe it is important for you all to know the signs and symptoms of endometriosis. The most noticeable sign of endometriosis is how you feel. The first is severe pain before and during your menstrual cycle. The pain can be present in your lower back and over your entire abdominal region. Also, you may have had difficulty conceiving a child. Excess bleeding with clotting is not uncommon. Untreated and undetected endometriosis can also lead to endometrial cancer. Now you all know the signs and symptoms of endometriosis. Now it is important to know how to detect the disease. True detection can only be obtained by seeing an OBGYN. Pelvic exam is by far the easiest. Your doctor may feel an abdominal region to see if you have endometriosis. He or she may feel for lumps due to endometrial scarring and tenderness. Ultrasound is another non-invasive form of endometrial detection. This is used to determine any deformities in your organs and them being stuck together. Laparoscopy is another invasive way to detect endometriosis. Your doctor will use a small camera to detect if you have the disease by inspecting your pelvic organs in their entirety. Although in your lifetime you may not personally have endometriosis, there are many different ways that family members, loved ones, friends, or even your coworkers can benefit from your help. There are many ways to help someone with endometriosis. Help that person with chores around the home during their menstrual cycle. The pain that they're suffering with endometriosis is nothing short of requiring a morphine drip. Offer to pick up their children from school. Do their grocery shopping. Help with a task at work that requires physical labor. This is only a small amount of things that you can do to help, but to someone suffering with endometriosis, this could mean the world. Most importantly, I hope I've opened your eyes to this widespread disease. Today I discussed the 4 main points that everyone should know about endometriosis: the risk factors, signs and symptoms, what you can do to treat the disease, and what you can do to help others fighting the disease. Endometriosis is a silent disease. Many women are labeled as being overly dramatic and unrealistic when describing their pain. I hope that I've shed some light on this disease that someone in your life may be unknowingly suffering with. I hope that it has become a realization to you that you can persuade them to seek treatment or at the very least offer compassion for their pain symptoms. Thank you.
Thank you.